Hi, I'm Dr. Bertalan Meskó, the medical futurist, and today I want to introduce you to one of the most interesting philosophical thought experiments and how it relates to artificial intelligence. I'm talking about the trolley problem.
Imagine you're watching a runaway trolley barreling down the tracks, straight towards 5 workers who can't escape. You happen to be standing next to a switch that will divert the trolley onto a second track. Here's the problem. That track has a worker on it too, but just one.
Do nothing, and the trolley kills the 5 people on the main track. Pull the lever, diverting the trolley onto the side track, but it will kill 1 person. But then you are directly responsible for killing a person. Which is the more ethical choice? Would you kill 1 person to save 5? And today, when many of such decisions are made by artificial intelligence-based technologies, the problem is that you and I, we are all tied to the tracks. So let's take a deeper look. This issue is even more complicated than it sounds. This ethical thought experiment, known as the trolley problem, was put forth in 1967 to think about the consequences of an action and consider whether its moral value is determined solely by its outcome. These days, the ascent of self-driving cars made the trolley problem the best example in thinking about AI-controlled decision-making.
Let's say at some point in the not-so-distant future, you're barreling down the highway in your self-driving car, and you find yourself boxed in on all sides by other cars. Suddenly, a large, heavy object falls off the truck in front of you. Your car can't stop in time to avoid the collision, so it needs to make a decision. Go straight and hit the object, swerve left into an SUV, or swerve right into a motorcycle.
Scenarios like these will inevitably come up more as we automate such a dangerous technology. So what should the self-driving car do? Should it act with a reactionary panic move, like we would, and prioritize our safety, even though it might end up causing a higher death rate? Or should it make the educated decision and try to make the best of the situation by perhaps killing us, but keeping everyone else on the road safe, which would essentially be a premeditated homicide? But maybe out of all the possible words, that's the one with the least casualties. It's a tricky one, right? What if you could feed the AI more data than that, and it wouldn't determine the best case scenario just by looking at the potential death toll, but by looking at the value of the people who will survive? A highly advanced AI could make that decision in a split second. In China, we have already seen the system of social scores in place, and we could take it a lot further. Let me present a dystopian nightmare. By feeding a system like that with medical data, this hypothetical self-driving car could make the decision based on how much the potential survivors could still live and contribute to society. This is where it all gets really cold and calculated. Unfortunately, with the coronavirus pandemic, we have already seen this thought experiment becoming a reality.
You've got me on one gurney, and you've got a 25-year-old on another gurney. You've only got one ventilator for the 2 of us. Who gets the ventilator?
In Lodi, Italy, this dilemma became painfully real during the peaking days of the pandemic. Doctors had to decide which patients to get ICU beds due to the shortage of resources. As the numbers of the COVID-19 infected patients climbed, certain healthcare institutions were facing a drought of key resources like personal protective equipment, ICU capacities, and ventilators. This prompted authorities to issue ethical guidelines directing medical staff as to which patients to prioritize. One of these guidelines recommended prioritizing frontline medical staff, and among severely ill patients, the younger ones with fewer coexisting conditions. Another guideline issued to Italian doctors noted that an age limit for the admission to the ICU may ultimately need to be set. And some American states had different sets of guidelines, like to exclude ventilator support from those suffering from neurological impairments and conditions like dementia or AIDS. What if, instead of leaving such morally challenging decisions to a human, an AI would handle this burden? Would it alleviate the psychological toll on the medical staff? Would it make better choices? The obvious benefit, other than taking this psychologically traumatic problem away from clinicians, is that an AI could look at a way broader picture than an overburdened clinician with simplified guidelines ever could. For example, despite guidelines, there can always be outliers that don't fit those rules. What if a younger patient has a higher risk of breast cancer than the older woman who is financially supporting her son through university? AI could mine for insights based on a patient's genomic data, their health records, and their family history. It could deem that a patient would react better to a drug under trial and would benefit from ventilation support until the drug reaches the hospital. And by monitoring this patient's progression, it would help even more people down the line, superseding the guidelines which would otherwise exclude that person from priority treatment. Don't worry, even if in the future this scenario becomes possible, we are certainly decades away from it. But let's make something clear. Morally, in such situations, a human being cannot make good decisions, because there are no good decisions. But what if an AI can alleviate the doctors from such psychological stress? And that's only a small slice of the problem. The giant problem at the heart of the AI troll issue is bias.
We as humans are biased. We have a lot of prejudices, some that we know about and some that we don't. And there's this idea that if you turn over decision-making to computers instead of humans, that we can avoid some of these biases. But we're learning that algorithms can be just as biased as the humans that create them.
An AI system is only as good as the datasets it is fed with. If the data that such an algorithm is fed with is influenced by judgmental datasets, ingrained social injustices, and individual choices, then the software's output will reflect such biases. And given that healthcare data is extremely male and extremely white, an AI will factor its decisions based on this demographic at the detriment of others. Let me give you an example. Amazon's HR department developed an AI-based machine learning tool which the company developed for sorting out the best job applicants. But as it turned out, the smart algorithm favored men. As the tech scene is mainly dominated by men, and the data that the software was fed with contained resumes from the past 10 years, the program taught itself that women were less preferable candidates. While programmers tried to tweak the AI, it still didn't bring the expected results, so in the end, they decided to scrap the program entirely. But this problem spills over to life and death situations. A 2014 study that tracked cancer mortality over 20 years pointed to a lack of diverse research subjects as a key reason why Black Americans are significantly more likely to die from cancer than white Americans. In another area of research, studies from around the world found that 81% of participants in genome mapping studies were of European descent, which has severe real-world impacts. Researchers who use publicly available data to study diseases are far more likely to use the genomic data of people of European descent. These same distorted datasets would be the starting points for AI development. Let's see a theoretical example too. If we develop an algorithm that we want to be able to determine if a person is a scientist by feeding it with profile images of scientists of the past 500 years, 99% of them were white male. So the algorithm, based on the data, will conclude that women and people of color cannot be scientists. In the case of the AI trolley problem, if the datasets are faulty enough, it's possible that an AI would choose to save the one white male on one of the tracks if on the other one there are 5 women of color. It's terrifying, isn't it? An all-powerful artificial intelligence that's sexist and racist as hell. So ethically speaking, doctors should never be put in a position where they have to choose between a 40-year-old or a 75-year-old patient to give ventilator support. In that sense, it's good to pass over solving issues like the trolley problem to a much more capable, comprehensive and advanced algorithm, an artificial intelligence-based system. But as you see, that would open up a whole another can of worms. Because if we take a step back and look at the bigger picture, we will see that when we hand over complete control, it's going to be all of us as people on the tracks, rather than the ones behind the lever. So we have to dedicate enough attention to solving the bias issue of AI and make the proper decisions in a collaborative effort of the general public, ethicists and AI's developers. We have to raise awareness and push tech companies to fix it, otherwise, while we fight for racial justice in today's world, we will face an even worse tomorrow. If you like this video and want to hear more about artificial intelligence and the future of healthcare, please subscribe below.